Well, ladies and gentlemen, it's exactly on time for this session. And you know, this conference has been very busy. And we know that we have a very brief time for each of these sessions to ensure that we can actually cover as much as is possible. So we have a lot of people still joining. And as they join, I will start off the conversation. I see the numbers are rising quite rapidly. So as we wait for the numbers to go up, I will start off with the housekeeping issues. My name is Dr. Githinji Gitahi. I'm the Group CEO for Amref Health Africa. I am also the chair of the steering committee for the Africa Health Agenda International Conference. I recently co-chaired UHC 2030, a position I relinquished a few months ago to increase diversity at the UHC 2030, and I'd served already for quite a fairly long time, and also for other growing responsibilities. So I am here now as also a commissioner or part of the panelists of the Future Proofing Africa Sustainability Index, and your moderator for this session. This session will go on for 1 hour, and we have, other than myself, we have 4 panelists, and the 5th one with whom I'm going to do a fireside chat. And I'm going to introduce them one by one, but maybe as people join as a way of background, we have great panelists with us today, and I will tell you who they are so that everyone is aware of who is joining us today. To begin with, we have Olumide Okunola, who is a senior health specialist with the World Bank in Nigeria, who will be joining us here. We have Professor Glenda Gray, who is the president and CEO of South African Medical Research Council. We have with us as well Dr. Saber Boutayeb, professor of medical oncology, University of Rabat, Morocco. And we also have with us Seth Akumani, head of exploration, UNDP Ghana. Those are our panelists who are going to be sharing certain segments of the Sustainability Index. And at the same time, we are joined by Amin Ben Abdallah, who is the general manager, Roche, Tunisia, and Libya. So I am a moderator, Dr. Githinji Gitahi, and we are going to go now into getting ready for this panel, or we are already here, and we thank you most sincerely for joining us. I see we have very good participation, which is still going up. It's not many virtual panel side sessions that you find close to 200 people joining. So that is that tells us the importance that you attach to this issue. A few housekeeping issues. One, this session has translation. So if you go to the bottom of your Zoom page, you'll find the globe interpretation. You click that and you choose either English or French. We are only doing 2 languages. So if you choose English, you'll get your translation into English, even when you're speaking French and vice versa. So please choose your language. Second, we have a section on charts. You can give us your views on chat, but we have also a Q&A. So if you're asking a specific question, so that you're able to track the questions and respond to each question directly, because normally when you go on chat, by the time the chats come down, you find you're responding to a chat, maybe several chats after somebody else has put in their comments. So I would encourage each of us to, as much as possible, try using the Q&A for questions and chat for your comments. The next thing I want to say is that we will have several polls during this session. And when the polls come, we are going to draw your attention to them, and we are going to ask you to answer the poll so that we can collect as much data as possible. And finally, this session is being recorded and will be available for the next 90 days on our AHAIC 2021 platform. So you'll be aware of that so that you can refer other people to come and watch it. You can watch it after yourself, and also for you to be aware that we are recording. Thank you very, very much. So as we go forward, I would like to just do a very quick high level of the Future Proofing Healthcare Initiative and the Africa Sustainability Index. For one, I am delighted to be moderating this. And today, what we are going to see over the course of this 1 hour, we are going to hear from a diverse group of African healthcare experts and health experts on key areas. One, the area of regional collaboration. Secondly, the area of financing. Third, the area of using technology to tackle systems change. And finally, gender equality. But before we meet these experts, a few points here. And I want to ask you to imagine your pilot flying you without current data, flying you without a dashboard, and at any one point, trying to look for information about the weather pattern where they are a year ago. That's how the health system operates, where you're actually flying, and when you want to know what is the mortality rate now, what is the morbidity rate, what is the rate of incidence, what is going on with NCDs, you have to base your data on last year's data in many cases, or maybe a quarter ago. You have to base your decision making in many cases on what we call national surveys that are done every 5 years. And we keep saying the prevalence of hypertension in this country, the prevalence of this and this, or indeed the financing level in this country, in this community is this, but the data is a year old. That's like your pilot flying you to New York or London or South Africa, or indeed flying you to Lilongwe, but they're relying on data which is several months old. I'm not sure you'd enter that plane, but that's what we deal with in the health sector. So we are looking at how do we move forward on this. So the Africa Sustainability Index is a part of the Future Proofing Healthcare Initiative, which is actually a first of its kind. It's an online policy tool that's going to provide unique overview of the current status for now focusing on 18 health systems across Africa. The index is created by 76 different measures that have been split into 6 categories. Category 1 is access. Category 2 is financing. 3 is innovation, and then quality. And then, of course, when you put all these things together, you end up with what you then may call the impact. What is the health status? So there are also measures of the health status in this index. And also, what is the contribution of the wider factors outside the healthcare system that impact outcomes? We know very well education has a much bigger impact on family planning uptake than the health system itself. We know very well nutrition and where people live has a big impact on health. So how do you put all these factors together? The index uses all variables, all these that I've talked about, 76 different measures, split into 6 areas, and puts them together, and then assigns each country an overall score that is based on their performance across all these dimensions. And as you can tell, when you look at this, they are all falling into social, political, technical areas. As we say, health is actually as broad as that. I want to note that the data we input in this index, because I am also a member, I'm one of the panelists on this independent panel of experts that was put together. The data is robust, it is credible, and it is all third-party data and actually available open source. The measures that were put into this were identified by panelists, the members of the panel, including myself, and these members of the panel, as you will see, have backgrounds in health systems, international organizations, think tanks, and academia from across the continent of Africa. And more specifically, we also have members from the World Bank, UNDP, UN, CDC, Medical Research Council, leadership, professors, and healthcare workers, including doctors. Altogether, we make up a diverse group of medical professionals across Africa that actually oversaw the development of this index. So simply put, ladies and gentlemen, the Africa Sustainability Index was created to bring people from all parts of the health system and their thoughts and their experiences together to ask questions, challenge the status quo, and when necessary, face difficult realities that the continent faces, all with the aim of improving patient outcomes. or improving people's outcomes. Because again, as you will see when you look at the wider aspects of the issues that affect health, they're not all health care indicators. Many of them are health indicators that just go beyond health care. And now, this time is actually more important than ever. As we've seen in the healthcare systems, we are striving to achieve universal health coverage, but we are also now faced with a global pandemic. So as we aim to achieve universal health coverage, which is actually under goal 3 of the Sustainable Development Goals, and for universal health coverage specifically, a target within goal 3, which is target 3.8, we are facing the pandemic, which is actually challenging our health system, irrespective of the country's income levels. And the question is, can our health systems rise to this challenge now and into the future? So we know it is vital to identify data-driven ways to recover from this crisis, and also to show up the system resources so that the next challenge finds us much better prepared than this one found us. So to begin, unsurprisingly, it's clear that economic strength is a key driver behind overall performance. This is what we've seen in the index, that you cannot ignore the economic strength of a country, but at the same time noting that economics and economic ability is not the only contributor to good health outcomes. We've seen countries that actually have lower economic expenditure on health, lower GDP, but with better outcomes. And therefore, the ability to finance the health system is as important as the ability to use the funds efficiently. The index core patterns are suggesting that a definite relationship exists between economic strength, health expenditure, and health system sustainability. Those are key things that we've seen in the index. More interestingly, countries with relatively good access to services do not necessarily top the index for quality of the health services provided, and vice versa. So the fact that access is high doesn't mean quality is high. So South Africa, for example, just picking a few countries, Zambia, Morocco, make it to the top 5 for both vital signs of quality and access, showing very good progress towards achieving UHC. South Africa, Zambia, Morocco, just picking a few. But the index tells us that a country like Tanzania has high quality health services, though it doesn't have optimal access. So you may have limited access, but Tanzania shows in the index that has very high quality of services. Libya, on the other side on the index, scores very well on access, but could improve on quality. So you can tell that the fact that you have access doesn't mean you have quality. And these have been reflected on in many of, if you look at the AHAIC Global Monitoring Report last year, it reflected on these issues, that despite the fact that access is increasing, quality is not in many cases. And also financing is not, that access may be increasing at the expense of the vulnerable. What this tells us is that these two priority areas of access and quality need to be approached in a holistic way by policymakers in order to make sure that impact on UHC, on achieving UHC, is seen. Another key insight, other than these two, is on innovation, which has the lowest mean score, by the way, of all the vital signs that the panelists have seen. Well, there are many great examples of countries adopting or even creating technologies to bring new solutions to bear, like South Africa, Rwanda, Ethiopia, Tanzania, who scored fairly well on the innovation vital sign. There's still room for growth when it comes to advancement, scaling, access, and application of the novel technology. So, scaling has been our biggest challenge of innovation. The opportunity obviously exists to create future-looking policy and legal environment, which in many ways inhibits the growth and scaling of innovation, of adopting new technologies, as we have seen in some of these countries. However, all countries from the strongest performers to the weakest in each of these vital signs have opportunities to improve based on the findings and best practice outlined in the index. Indeed, the real purpose of this index is that this cross-border data and knowledge gives us an opportunity for knowledge sharing, to democratize data, democratize access, democratize approaches that actually countries can learn from each other and adopt a certain contextualized delivery of UHC, but we're learning from others. Notably, all of this data is publicly available. So I would urge you to go to futureproofinghealthcare.com, futureproofinghealthcare.com, where you will actually find all the data and the comparisons. So I would like now to come forward so that we can hear from our panelists. We are going to invite each of the panelists to talk about a particular area, and when they speak, there'll be a poll that comes up, and please participate in this poll. So to begin with, I would like to ask all the panelists now to put their videos on so that we can see them. Please put on your videos for the panelists. And I'm going to come straight. We've agreed with the panelists to use first name basis, so that we can make this easy flowing. So I'm going to go straight to Dr. Saber, who is a professor of medical oncology at the University of Rabat in Morocco. And Dr. Saber is going to address regional collaboration and its impact on further innovation. Dr. Saber, the floor is yours.
Thank you, Githinji. First of all, thank you very much for inviting me. That's right. I believe that regional collaboration is a critical component to the future proofing of African healthcare system. And I will tell you about 3 ways I feel that it can be achieved, as well as example of how it's already happening in my region, I mean in North Africa. So the first point that I will discuss is the necessity to build regional research clusters. And we all agree that there is a growing awareness in Africa on the importance of research and innovation. But there is a gap in moving from this awareness stage to real-life projects, namely due to the lack of human and financial resources. We must build regional research clusters where countries work together to provide assistance and financing to design innovative research projects. For example, the Institut de Recherche sur le Cancer, which is in English a research institute on cancer, located in Fez in Morocco, covers cancer research, notably basic research, clinic, epidemiology, and as well as human and social sciences. Last year, this institute had organized his first international congress on cancers in low to middle income countries in order to promote a regional collaboration. One of the major projects expected to be launched this year is development of nationwide telepathology consultation and quality control program for cancer diagnosis. The second point will be to share data across national borders. Sharing data is absolutely fundamental. The researchers are used to publish their work in international scientific journals. Nowadays, the most cited articles worldwide are from international collaborative groups. At the academic level, there are many collaborations between North African countries and beyond, between African countries in general. To address the urgent and specific need for pediatric oncology, for example, in French-speaking African countries, a group of physicians and volunteers created the French African Pediatric Oncology Group in 2000. The French Pediatric Oncology Group is comprised of 8 units across six African countries, with the objective of studying pediatric cancers in Africa, with an effort to improve diagnostic and therapeutic tools, as well as develop a database on pediatric cancers. This group had already published more than 20 indexed articles in the Medline database. This group is also an excellent initiative for initial and continuous medical education. Notably, these aren't formal or government-driven partnership. It's the initiative of those working in healthcare systems driving this collaboration. The third point is to prioritize public-private partnerships, and this point is absolutely crucial. Public-private partnership, as I mentioned before, many of these collaborations are led by the private sector. However, the public sector plays an important role. One of the good examples of PPP, or public-private partnership, is MASIR, the Moroccan Foundation for Advanced Science, Innovation and Research. This institution is based in Rabat, Morocco, and it sets a framework for research contracts with manufacturers and enables collaboration agreements with research centers and academic players, as well as organizes scientific events. The national visibility of MASIR has increased since it has designed the country's first COVID diagnostic kit. The test was tested and validated by national and international laboratories, such as the Pasteur Institute in Paris. I will finish with a brief call to action. There is plenty of work to be done to make real national collaboration happen. It will require pre-planned objectives. The best way to start is to start at the academic level. We cannot wait for the political collaboration between two countries to drive forward our healthcare systems. In my opinion, we should focus on regional advanced training for African healthcare providers to empower them to deliver better educational, diagnostic, and treatment services to their patients. The second point is to work on the implementation of regional clinical studies to evaluate the efficacy and the safety of currently available therapeutics, specifically in African patients. We have no choice. We should absolutely collaborate together in order to enhance our healthcare systems and to guarantee for our patients the best standard of care. Thank you for your attention.
Dr. Saber, thank you so much. It is obviously evident, and please go ahead and participate in this poll right now before the poll ends and we move to the next speaker. So please, on regional collaboration, participate on that. And Dr. Saber, thank you very, very much. It is evident that obviously public-private partnerships in African healthcare and sharing of data across the continent, within countries and across the continent, is paramount to achieving collaboratively formalized health systems. So this is very clear from your presentation. as well as the fact that without that, you can't foster innovation.
Yes.
So thank you for sharing all those examples. And I think now, when considering this idea of innovation, technology plays a big part in innovation. We know that innovation can be on technology or off technology, but technology has played a really critical part in innovation. And with the advancements and capabilities that are available to us now, we are seeing AI, artificial intelligence, and others. There are certainly opportunities for technology to contribute to sustainable health development. So coming off from Dr. Saber's presentation, I want to zoom in a little on this area of technology and ask Seth Akumani. Seth, he is the head of Exploration Accelerator Lab at UNDP Ghana. Seth, could you share insight into how technology can be used to speed up system-level changes and improve health delivery? Seth.
Thank you, Dr. Githinji. I'll just like to build on from where Saber left off. And like you mentioned, indeed, I am delighted to talk to you about how innovation, which I believe is a cornerstone of future-proofing healthcare in Africa. Well, there are several examples across the continent of innovators doing fantastic work to deliver better healthcare for patients. But as you mentioned, this is the region or the area where the region's mean score is the lowest, which means we have work to do. So I want to highlight about three key areas where we can use technology to improve healthcare delivery. The first area where I think technology can help us is really using mobile and digital technologies to improve access and delivery. We know that many Africans are still living on tight financial budgets, which means long distance to healthcare facilities and the cost of care are common reasons why people do not seek early and preventive healthcare. So using mobile and other technologies to improve primary care access and the delivery of essential medicines can therefore make a massive impact in our ability to improve health outcomes. There are already a number of examples in this area that I can highlight. So for example, M-Pharma through their mobile solutions providing access to essential medicines for more than 2 million Africans in six African countries. Pediatric is also doing great work using mobile technology to protect citizens from fake and counterfeit drugs. And we know that Access Afia is also doing wonderful work in Kenya through their mobile healthcare clinics. So indeed, mobile provides us an opportunity to really overcome some of the challenges that you mentioned earlier. And we do have the fastest growing mobile internet penetration in Africa at the moment. So the challenge is, how can we do more with the technology for medical purposes? So I think this is probably the first area that I want to highlight. I want to go on to the next area is really about digitization of health records. Many African healthcare systems are still burdened with paper medical records. But data from the index shows that there's limited uptake of electronic health records and e-health solutions across the continent. Ethiopia and Morocco are the front runners in this space. And if you browse through the index, you'd see that countries like the DRC and Mozambique have a lot more work to do. But quality health data is really essential to improving the quality of care for all Africans and in assessing the health status of citizens in the country. And interestingly, these are part of the vital signs and measures that the index talks about, healthcare quality and healthcare status. So there's huge opportunity in this area for us to design solutions for digitizing health records that are tailored to the local context. Health eNight in Kenya is probably one I want to spotlight, but there's a huge opportunity in this space, and frankly, we're not doing a lot at the moment. So that's another area where we really need to look at. The third area I want to emphasize is really around using technology to leapfrog some of the systemic issues that we have. We all know that the COVID pandemic has really brought into focus some of the unique challenges that continue to plague our healthcare systems, poor funding of public healthcare facilities, the limited ICT infrastructure, sometimes also limited technical literacy in our healthcare institutions, facilities. But technology has a unique role that it can help us leapfrog some of these challenges. And we're already seeing examples in action. Last year, zipline drones were used to deliver COVID-19 tests in Ghana, and they are being used at the moment to deliver COVID-19 vaccines as well. So this is a classic example of how we can use technology to overcome some of these challenges. So in these three areas, using mobile and digital technologies to improve access to healthcare, primary care access, digitization of healthcare records, and even using technology to leapfrog some of the constraints. I think that perhaps the area which offers us the greatest opportunity is really using mobile and other technologies to improve access to healthcare and delivery of essential medicines and care, because this is the greatest area. This is probably the area where we can have the greatest impact towards our drive towards universal healthcare coverage. So just to leave it with a parting thought, the index has given us a fantastic report card of where our healthcare systems are and our progress or otherwise in some of the critical areas. And as you heard earlier, what we don't measure really, we can't improve. So I would want to make a clarion call to everyone who's joined today that, fundamental to our ability to improve healthcare and its sustainability in Africa is also our ability to collect quality data and to draw key insights and intelligence from this. So let's use this opportunity as we launch the Future Proofing Healthcare Index, to think about how we can collectively collect quality data and develop the needed insights which can help us drive and inform action and policy. So thank you very much. And the future of healthcare is in our hands. Over.
Seth, thank you. The future of healthcare is in our hands. And you make a very important point there that taking advantage of mobile and social networks is certainly something we need to consider. In fact, in the index, Seth, we found that access to internet and mobile connectivity within the wider factors as a facilitator of innovation from a data-driven perspective. At the same time, it is clear, obviously, that proactively measuring for improvement and in turn creating local innovation opportunities to address accessibility and affordability is one of the cannot be overstated. You've summarized all these things really critically, and the index starting to look at how to move this forward. So on this area of access and affordability, these are two gaps that have many contributing factors. And we've talked about economy, social issues, technical issues, and they're often impacted by the services and infrastructure available. And on this note, and because this was part of the panelist work, I would like to invite Olumide, senior health specialist at Rabat, Nigeria, largest population in Africa, largest mobile penetration. So Olumide, you could just highlight for us, how do you share your thoughts with us via, on how can we prioritize these areas to address these system gaps that exist from your experience and from the experience of your country and as a panelist as well? Over to you, Olumide.
Thank you so much, Dr. Gitahi. Basically, I think I just want to argue that the current system weaknesses that we're seeing and that became so obvious in the index was driven partly by the inadequate and inefficient health spending across several of our countries. And I want to argue that one way that we can reprioritize or one way we can address the current system gaps we're seeing is by reprioritizing the way we finance and spend on healthcare. Indeed, I'm going to argue that without doubling down spending in our universal health coverage efforts, then progress will be very slow indeed. But beyond arguing for additional and increased health spending, I will say that there are two complementary factors to that: improvement in quality healthcare and a focus on preventing future pandemics. So the first point that I will do a very quick deep dive on is in terms of reprioritizing health financing. What exactly does that mean? So I would say three things in that regard. First is that countries need to increase budgetary allocations to health. Two, countries will need to support and prioritize the poorest and vulnerable in the society. And thirdly, governments would need to begin to look in the future and understand that the emerging trend in terms of the increasing rise in non-communicable diseases is something that governments will need to begin to address now. So why should we increase or prioritize health spending? If you see what happened last year, all countries globally increased almost 3, 4, 5, 10-fold their spending on health care. And I'm sure several people on this call would have made many advocacy pitches, discussions with policymakers on the need to increase health spending. However, it took COVID-19 to achieve that kind of health spending that we saw. But now, because of the double shock of the pandemic itself on both health and the economy, what we're going to see now will be a sort of pro-cyclical approach to health spending, where because of most countries are in a recession, health spending would also drop in tandem with that. I want to argue that, in fact, this is not the point that we should let our feet off the pedal. In fact, that increase in health spending that we saw last year should be the norm. And we have a strong case to say that. One, you're going to have a spike in infections. You have to roll out vaccines. You need to bolster your pandemic preparedness. People, the health care and hospitals. So there is a pent-up fast track our journey towards UHC. So first point, big point I'm going to make is that this is the point to prioritize public financing for health in our budgets. That there are fiscal constraints. In an environment of fiscal constraints, it means you need to prioritize the weakest, the poorest, and the most vulnerable in our society. And this you can only do successfully if you guarantee a fully funded explicit benefit package for those populations. The failure to do so would mean that you're going to tip a whole lot more people into poverty. And this would affect their security implications, their human capital formation problems, amongst other things. The third thing you need to do in reprioritizing health spending is it's important you begin to prepare for that future epidemic of non-communicable diseases. We need to begin to invest in information, education, communication that addresses diabetes, cardiovascular diseases, mental health, amongst other things. Not doing so now would mean that we're going to spend 10-fold, 20-fold in the future. And the index is already showing us this, that without prioritizing, without raising, pooling, purchasing services in an equitable manner, we're gonna encounter a whole lot of problems in the future. And I wish colleagues would take this to heart. The second point, beyond advocating for financing, which is a sine qua non, is that without focusing on quality and just like Gitahi, you mentioned at the beginning of this call and gave examples of what's going on in Tanzania, increased quality, low access. Libya, increased access, low quality. In fact, I would say that access without quality is almost a waste of everybody's time. And low quality is really pervasive across the continent. And sometimes we usually think that low quality is as a result of informal providers. Not necessarily true. We think that that low quality is found mostly in rural areas. Not true. It's both rural and urban. We think that, in fact, you have improved quality when you have a trained provider. Again, that's not true. Recent studies have shown that, you know, where you look at the no-do gap in terms of providers, do they really apply the knowledge they know when they see a real patient? It's almost pretty low across the continent, which shows that sometimes you might be better off probably even seeing an untrained provider, because the kind of level of proficiency shown by sometimes a trained provider is really problematic. So at the end of the day, I will repeat, Gitahi, what you mentioned in terms of what the index has shown us in terms of quality, but it means that, yes, I argue for increased financing, but that increased financing needs to be coupled with a focus on quality as well. And the last point on quality, if you are able to improve quality of healthcare across board, it allows us to begin to bring and harness the potential available amongst private providers. By the way, it's not true that you have poor quality amongst private providers. It cuts across. However, where you're able to institutionalize quality and be able to have incentives that motivate for quality, then you are able to even utilize in a constructive manner the public and private providers available in our country. Last point I make in terms of reprioritizing has to do with keeping an eye on preventing future pandemics. A statement of fact is that the ongoing COVID-19 pandemic is not going to be our last pandemic. So it will be foolhardy for us not to begin to spend appropriately to prevent a pandemic in the future. I mean, in my country, Nigeria, we had to build 70 molecular labs from 1 in February 2020. This kind of thing shouldn't happen again. Now is the time to deploy resources in a methodical manner, in a strategic manner, so that we can even be able to nip this in the bud before it blows into a full pandemic. And in making a call for action, I make 5 points. One, we need to focus on data. Gitahi, you mentioned, you know, in the health sector, we're like a pilot flying a Boeing without current data. You don't even have the current weather data. You know, that I think needs to guide the way we reprioritize and move forward. But within that data also, there's a lot of undisaggregated data. We need to be able to disaggregate in a manner that is meaningful and which will be able to reveal the different inequities that is embedded therein. There's also probably, this is the time for us to advocate more resources for health through pro-health taxes, the so-called health bags. Now, there's no better time to begin to say, look, can we have additional taxes from alcohol, tobacco, sugar-sweetened beverages? This gives us a good time to say we're not just asking for more money, we're also pointing our policymakers in the direction of where to get more money. Just to close, that we should, countries across board should take quality as a corollary to additional spending, and we should mark and note very critically that this will not be our last pandemic, and the earlier we begin to build out the infrastructure to prevent such pandemics, otherwise this will be a failed opportunity. Thank you.
Thank you so much. I think you made really important point, investment tools, the issue of investing in the weakest sectors. You also talked about access without quality is a waste of time. There are many issues here that you've covered that are really critical. I would like to come now on, and what I would like to request my panelists is go to the chat box or the Q&A, and please help us answer the questions from the delegates, because I'm seeing like we may run out of time for Q&A. So if you can kindly post your question in the Q&A, my panelists will do everything possible to answer those, as we now call Professor Glenda Gray. Now, Glenda is the president and CEO of South African Medical Research Council. Professor, we agreed I call you Glenda. So Glenda, we are very interested to hear more about the relevant measures that impact gender equality and how to address the gender gap that affects the outcomes and quality of healthcare delivery. We saw that a lot of our responses on COVID were gender blind. Government did policies that were gender blind, locking curfews without announcing how pregnant women will access care. And you wonder, was there a female cabinet minister in the policy-making room? How do we close these gender gaps? Over to you, Glenda.
Thanks very much. Can you hear me?
Can you hear me okay? Very clearly.
So last but not least, even though I'm the last person to talk, gender is very important. So I'm going to talk about gender equality in healthcare. And this is the last of these pictures. And I think it's something that's important for everybody on the top of our minds. There are many measures we reviewed as part of the African Sustainability Index that pointed towards gaps in this equality we're all striving for. And I'd like to spend a few minutes highlighting key examples, but most importantly, what can be done and what we should be done about it. So let's first talk about the first issue, and that is improving reproductive health. So data from the index shows that there are stark differences across our continent on access to reproductive health services. And this includes both family planning, antenatal care, and even nursing and midwifery personnel. We know that there's a positive correlation between access to these services and good outcomes in terms of maternal and neonatal mortality. Where access is restrained, women's health generally takes a toll. So many African countries are conservative, and we know something, and we need to address this. But we do have to emphasize that adolescent and young girls need to be able to access contraception. One of the biggest predictors of poverty is teenage pregnancy, and we can take steps to avoid girls unnecessarily missing school or falling behind because they get pregnant. So it's very important to stress the importance of access to family planning. South Africa has legal termination of pregnancy, and this has helped us women take autonomy and be able to make autonomy over their reproductive rights and health. One of the other things that we have fallen behind in Africa, and which is something that needs to become an important issue for women, is the disparity around access to the HPV vaccine. We just don't have enough vaccines at a global level. And when there's no vaccines at a global level, Africa bears the brunt of it. And we must make sure that there is a concerted effort to address the lack of HPV vaccination on our continent. And the same thing goes with teenage pregnancy data. We need to make sure that we have indicators that track teenage pregnancy over time and do assess the importance of interventions to reduce teenage pregnancy. So the second thing, after reproductive health, I want to emphasize the importance of primary and secondary education for girl children. We know that adult literacy is predominantly higher amongst men than women in the countries covered by the index, meaning that women are disproportionately affected by not having appropriate education. And we see a correlation between the gender literacy gap and life expectancy gap. So where there is poor access to education, there's also poor life outcomes and poor life expectancy. Countries who are lower on the gender literacy gap will score lower on the second measure of life expectancy. And so there is a case to be made to increase women's access to education so as to provide them with the basic knowledge to take care of their own health and for them to realize life expectancy. While this may be as SDG focused, we do need to develop policy and programs to help girls get out of poverty and even better, avoid poverty in the first place. One of the things that's very important to me as a woman in health leadership is the need to elevate women in health system leadership. First of all, in order to reduce the gender inequalities that currently exist when it comes to health outcomes, we must in Africa increase the number of women in leadership within the national health systems. Ensuring that women can make decisions that will impact women will certainly have an impact on outcomes. As we heard from Gigi, he stated that when we imposed curfews, we neglected to address the need for women to access healthcare during the night because they were pregnant or because their children were sick. And so we did see less women accessing care and being fearful to travel during curfew and during the second and the first and second wave. And it's important to elevate women in health leadership because women too often step aside for their spouses, they step aside for their children, and women often take technical jobs instead of leadership positions. And we need to find ways to enable women in Africa to take leadership positions and to rise and address the issue of gender parity. So if we set indicators to understand women if we set indicators to understand why women aren't rising in these ranks, we can start to address them and start to track countries by their commitment to gender parity and supporting women in leadership roles. So just to close, I'd like to invite you to complete the survey. And I also welcome your feedback. Are there places or examples where countries are driving gender parity in leadership roles? And what have been the enabling environments and what have been the challenges and the issues that women faced when they became leaders in health? So thank you very much, Gigi.
Fantastic, Glenda. And please continue to fill the poll. I don't know, I have feedback. IT, please check. I should not have feedback. Thank you. Thank you so much, Glenda, for that. That was a fantastic presentation on the role of gender equality in health. Yesterday was International Women's Day, and the theme was, I Dare to Challenge. Most of the things that Glenda talked about, my dare to challenge yesterday was that I dare to challenge that women need fixing for them to rise to leadership. What needs fixing is the systems, the laws, the norms, and the policies that stop women rising in leadership. Women have no problem that needs fixing. So thank you very, very much for that. Now, I would like to come over to our last conversation, a fireside chat with Amin Ben Abdallah. I am pleased to introduce Amin, who is a country manager of Roche, Tunisia, and Libya, to join me in this conversation. And of course, Roche is, of course, a key player in the creation of this index. You've supported it. I forgot to mention earlier that the index was independently supported by Roche, but the partners, all the panelists were independent. But Roche, through an arm's length relationship, did support the development of this. And for you, how and why is Roche involved? What's your interest in healthcare sustainability? And where would you spend your resources for the development of this? We have only 6 minutes remaining, but I'm sure it's adequate to address this issue.
Thanks a lot, Dr. Githinji. I'm really happy and honored to be with you today, and thanks a lot for all the panelists. How Roche is investing and supporting this initiative, as you mentioned, we are providing financial support, but all the work has been done by independent experts, and we thank all of you that has contributed largely to this and bring it to life. Why we are investing into this? So this is a very interesting question, and basically the sustainability of the healthcare system is bringing like core elements of our vision. And in Roche, we are our ambition is to bring better outcomes for more patients faster. And we are working toward a future where every African patient can have access to a high-class healthcare system. And we believe that as a stakeholder sitting in the healthcare, we firmly believe that we should be working all together to make this change happen. Through future-proofing healthcare, we want to help countries learn from each other, and we have the hope that it doesn't stop here, but it starts from here, and will help open the door to co-create solutions where the system will be more sustainable, optimize our healthcare systems across all countries in Africa. And we know that no one can do this by its own. We need to have collaborative work, join forces, and we will make it happen. And I really enjoyed the discussion today and learned a lot from all the panelists. It was a great discussion and very insightful. And what I really impressed me today is that we are already into the future. So we turn this data to the future, and great call to actions coming from the different panelists. We heard from Dr. Saber, who is saying that academia should step in and start working on that. Also from Seth, a great example on how can we collaborate towards creation of data collectively. And here I'm really curious, Dr. Githinji, to hear from you. What are your own reflections with this data, and what are your key takeaways from today's discussion?
Well, I mean, it's very clear from the panelists and from the index that there are critical areas. One is that we need to not to put our foot off the pedal on universal health coverage. Our economies in Africa especially have gone into recession, and the likely reflex is actually to reduce investments in health. And we've heard from the panelists that this is the time to actually increase, because we've seen that health is actually a shock absorber for the economy. So that's the first lesson. The next lesson is that we can't do this just by pouring more money, that we can't just throw money. We have to put the money where it's needed, prioritize common goods for health, prioritize innovation, efficiency, because that means that even where the economies are challenged, they can actually manage to give good outcomes for their people. This is the other thing that that is actually coming out of this. But you can't do any of these things, which is very clear in the conversation, without prioritizing the most vulnerable and ensuring that everyone participates equally. Gender equality being at the center, but we can't do any of these things without measuring. How do you know you left women behind if you don't have data? How do you know that your innovation is working if you don't have data? How do you know that your health financing is going to the right place if you don't have data? So these are the points that are coming up. And through the conference, there's a big conversation around just building back better and ensuring that the health system is built for the next pandemic, not only for this one. Meaning we are looking at future-proofing, not looking back in our rearview mirror. Amen.
Thanks a lot. Thank you for this great insight. And by this, you touch base also on universal health coverage. How do you see this index helping countries and different plans towards informed decision to achieve our ambition for 2030 universal health coverage in Africa?
There are several things here. I mean, number one is that we know that universal health coverage has to be measured. We have to know within the framework of universal health coverage, which is part of the broader Sustainable Development Goals, which falls under Goal 3. Within Target 3.8, there are two areas. One, 3.1, 81 and 3.82, which measure financial protection and measure service level coverage. Now, the data that we found in this index is actually part of it also borrowed from some of the tracer indicators that are created for measuring service delivery index by WHO and others by World Bank on financial protection. So we see this as relevant for countries to see clearly what their roadmap is. They're on a road and the road is long and they need a dashboard to navigate. Secondly, this index and the data assist countries to learn, because the achievement of AHAIC, we keep saying that destination is the same, but the road is different. But we need to see who is doing what and how do we copy that and then apply so that we don't keep rediscovering the wheel. So this is what the index provides for us, I mean.
Thanks a lot. Last two questions. Any invitation to the audience today after the index? It's data, it's good, we have the dashboard, we know where we do stand today. What will be your invitation to the audience to work on that?
So I would say, number one, look out for the index, look at the data, use it for your own advocacy. If you are civil society, use it for your own policy if you're government. Use it for your own planning and development plan if you are a development partner. Use this data for your own planning so that we can future-proof healthcare together. The next area is to say that this index is not flawless. This index is going to be changing. It has many flaws because in many areas in the countries and areas that we are looking at, data is not properly available. That is a challenge even for the panelists when we are developing this. So please keep looking at the futureproofinghealthcare.com because the index is actually going to be dynamic and moving as we go. So I call upon you to look out for new changes, look out at the index, keep looking back, and keep contributing to us like you've done on the polls, because this helps us to improve the index. And please use it, because a static index will not help anyone to fly. Let us work together. And I think that is it. I mean, I must thank everyone here. Unless Amin has anything to say in 30 seconds, our time comes to an end in 60 seconds. Anything for you?
Thanks a lot. It was great.
Thank you very much. And to all our delegates, the panelists, I thank you most sincerely. This panel will come to a close in a few minutes. And when it does come to a close, please join the other panels. We keep the conversation and keep your eye on the website for changes on the index as the panelists continue to take your feedback to improve the already existing index. I thank you most sincerely, and thank you to the panelists who've been great. So thank you so much to the panelists, and thanks to the delegates. Thank you. Bye-bye for now. And thank you to Roche for making it possible.